So last week I talked about how there were different types of nurses, like the specialties you can go into. So this week I figured I would talk about how I guess you would choose your specialty. When you're going through nursing school, you do what's called rotations, and so you go through each of those specialties. So, like 1 week or it's longer than a week, but you would go through like from pediatrics to geriatrics, which is children to elderly people, or you would do men's health or women's health. Um, and so, like, rotations really does help you try to figure out which specialty you want to do because, um, not everyone is made for every specialty. There are some people who can deal with elderly people better than children. For instance, I know a nursing student who is going to be an oncology nurse, which is a nurse who would deal with cancer patients. And when she was going through rotation, she loved oncology, but she hated the NICU, which is the premature babies. And so most people would think that oncology would be really hard to deal with and that NICU would be even better, or not necessarily easier, but I guess less sad to deal with. And she thought it was the other way around. She liked dealing with the oncology patients. She felt like she was doing more. But then her friend liked dealing with NICU and didn't like being with the oncology patients. It's just some people have to be made for what their specialty is. A lot of people will find out more what their specialty is as they're going through their rotations, or some of them will declare general, and so they'll just kind of like float around, and then through that they can find their specialty, and their specialty may be general, so they just mainly will deal with patients who have had general surgeries, just like a gallbladder removed or their appendix removed, something like that. Um, and that may be something that they do, or they may they may want to go into a specialty. And usually specialties get paid more. So if you do go into the NICU or oncology, um, your paycheck will possibly be higher because if you specialize, you will get paid more by the hour. Because you will have to probably do more schooling for that specialty just so that you are more aware of what you're dealing with and how to take care of your patients and how to respond to emergency situations when things go wrong in those specialties. Um, and there's also different types of nurses that have to be willing to not really have a home life. They really can't be tied down to family or have to be willing to up and move if their job requires them to, like traveling nurses. A lot of times they can be called to a different state or even a different country, and they will be gone for months at a time. So they can't have families at home that need them to be there, depend on them, because a lot of times they won't be there to be home with them. Uh, you know, those kind of nurses have to be willing to almost be alone sometimes because they won't have people at home with them, or they may, but their families also have to be willing to give up their person who is the nurse so that she or he can go do their job because that is what they signed up to do and that's the specialty that they chose. And so it requires a lot of time to be put in and a lot of sacrifices to be made. And that goes for any nurse because nurses work long shifts and aren't always home to take care of the kids or to be the housewife. Or if it's the guy, they're not always there to take care of the kids or be the husband. And so being a nurse requires a lot of sacrifice, and so when you specialize, you are possibly taking even more time out of all of the time you've already put in to your job. And so, yeah, that is mainly how you would choose your specialty.